65 California emergency rooms have closed. That's 1 in 6 that have been lost.
A coalition of California medical and hospital groups joined together to put Proposition 67 on the ballot in 2004.
95% of Prop 67 funds go to keep emergency rooms open and support the people who will save your life in an emergency. It will cost about 50 cents a month. Please join us in voting yes on Prop 67.
The measure, projected to raise $500 million a year to pay hospitals and doctors for uncompensated care, was supported by dozens of medical, government, and community groups. But the largest telephone company in California, SBC, spent millions on a successful campaign to defeat it, because the money was to come solely from their industry, from their customers.
We were looking for a funding source that was spread out amongst everybody, with some regard to pay. If you're able to pay your cell phone bill, a 3% surcharge on that would amount to 50 cents or $1 a month per person. That 50 cents or $1 per month per person would have gone a long way to alleviating the crisis that's in front of us. Well, I hope something's done about the emergency care crisis.
The money to keep ERs open has to come from somewhere, and many feel the defeat of Proposition 67 was a lost opportunity to support emergency services.
Where's the patient?
A recurring theme sounded by ER doctors focuses on the large profits of HMOs and insurance companies that draw big money away from actual health care.
Healthcare premiums are just incrementally going up, 10, 20, 30% a year. Unfortunately, that's not being sent back to the people giving the care to those patients. Instead, what's happening is a lot of the HMO profits are essentially going to Wall Street rather than to patient care.
The game that's played is insurance companies employ a huge cadre of individuals to try and figure out how not to pay the bill, how to deny payment or reduce payment, or negotiate reduced contracts. The doctors in the hospitals have to employ their billing services to figure out how to maximize their collections and collect the money. So there's all this noise in the middle, this giant sucking sound coming from healthcare, taking dollars away from healthcare.
Another reason for spiraling costs, say ER doctors, are the high operating expenses and profits of drug companies that take even more dollars out of the system.
Back in 1990, the amount of money that went to pharmaceuticals was about 8 cents out of every dollar. Currently, that's at 22 cents of every healthcare dollar spent on pharmaceuticals, and projected by 2010 to be close to 30% of the healthcare dollar is going to pharmaceuticals.
The most serious charge is that the health insurance and financing system in America is uniquely bloated and inefficient.
Every other country in the developing world essentially insures 100% of their population. 100% at half the cost of what we're paying for health care. And part of the reason they could do this is they have universal single-payer coverage overseen by the government. We spent $1.8 trillion in this country in health care. Over $500 billion of that went to administrative overhead and profit. There's something very wrong with this system.
Another, more ambitious effort to overhaul health care financing is also underway in the California legislature. Senate Bill 840 proposes to establish the California health insurance system, a single-payer plan like Medicare.
It creates a plan with comprehensive coverage, everything that you would normally say, gee, that's in a health plan, plus dentistry, vision care, durable goods, all pharmaceuticals are all in this plan. Employers would pay in a small percentage of their payroll. Workers would pay in a small percentage of their income. People with unearned income, self-employed, everybody pays in a small percentage of their income, except people below a certain amount, who would be paid for by federal funds the way they are now, by state funds the way they are now. All that goes into this plan. And there is no uncompensated care.
She says efficiencies in the single-payer approach, as in other countries, would reduce administrative costs and save billions that could be redirected to patient care.
And that's why hospitals and doctors, emergency rooms, everyone, dentists, everyone, would do better under this plan.
But the single-payer approach also has its skeptics.
I'm not an advocate of a national health insurance program because we've done a less than admirable job with Medicare thus far. I just think we need to say to the lawmakers, if you're going to pass the laws making us responsible, then pass the legislation that gives us the reimbursement to fulfill the responsibilities that you have put upon us.
In contrast to many hospitals around the country struggling to balance their budgets, the Denver Health Medical System stands out as a model of how to make the system work for everyone and still stay solvent.
Donna? So I got the results of your blood work. Yeah, and your white blood cell count is much better.
Denver Health has 8 satellite clinics around the city and an urgent care center at the hospital. They all offer accessible health services for any Denver resident. Donna Neverett is not insured, but receives low-cost care that is subsidized through a Colorado program.
I just got on the CICP, which really helped me a lot because I couldn't afford to go to the doctor. So I did, and I pay a small amount to get seen and for my prescriptions.
She's been a regular patient at one of Denver's neighborhood clinics. This day, she's at Denver's urgent care clinic to see about a lump on her breast.
I do think that the lump is significant, and I want you to follow up on that.
Denver's system promotes just this kind of preventive medicine. If there were no clinics like these, she might have waited until her symptoms got worse to visit the ER, possibly ending up with a more advanced condition.
That's where the issue is that you want people to have ongoing care with somebody who knows them, who can just, they walk in and say, oh yes, Mrs. So-and-so, yeah, how are you doing? How's your leg?
Denver's network of clinics also benefits from an advanced computer system that connects physicians and clinics with any unit of the hospital, allowing them to instantly track a patient's progress. It is the local clinic system that keeps people healthier by nipping problems in the bud.
And it may sound unusual for a physician based in an intensive care unit to think about that aspect of our process. But there's no question that for me to do my job well and manage the very substantial flow through my ICU depends on my colleagues in our preventive environments in the healthcare clinics doing their job as well in a substantially funded fashion.
Ultimately, some say the ability to access health care, regardless of income, employment, location, or immigration status, will determine the future success or failure of our entire healthcare system.
We have to figure out a way to take the huge amount of money in this healthcare system and redistribute it so that everybody gets at least primary and emergency care provided to them, regardless of their ability to pay, regardless of whether they're working or not working, particularly those who are working. And it can be done.